While colorectal cancer rates have been declining overall since the mid-1980s, probably due to increased screening, we are seeing higher rates in adults under 50.
It looked at ages from 20 to 29, 30 to 39, 40 to 49, and early 50s. And it showed an increase in incidence in all of those ages.
Cleveland Clinic Dr. Megan Castillo is talking about a study from the American Cancer Society that was recently published in the Journal of the National Cancer Institute. The study found that after decreasing since 1974, colon cancer rates increased every year from the mid-1980s through 2013, 1 to 2% per year in adults 20 to 39, and an increase of 0.5% to 1% per year for adults aged 40 to 54. Rectal cancer rates are increasing particularly quickly, rising by about 3% each year from 1974 to 2013 for 20 to 29-year-olds. This same increase is seen for adults 30 to 39 from 1980 to 2013. And in adults 40 to 54, rectal cancer rates increased by 2% yearly from the 1990s to 2013. 3 of every 10 rectal cancer diagnoses are now in patients younger than 55.
Because that's the issue with colon cancer. You don't get symptoms oftentimes until it's too late, till it's already cancer. If you have any symptoms such as a change in bowel habits, for example, you go from having a bowel movement to every day to being constipated, or you go from your normal to having diarrhea, that change could be important. Certainly if you saw blood at any point, even one time on the toilet paper or in the toilet bowl, it's worthwhile to get checked, no matter whether you're 20, 50, or 80.
Current guidelines recommend colonoscopy screening to begin at age 50 unless you have a family history.
If your mom, dad, sister, brother, or children have cancer, then we recommend you come in at age 40 or 10 years younger than their diagnosis.
Is this study big enough that screening guidelines could change?
Yes, it is, and we here are discussing what the best way to do that is. There's a lot of different alternatives. One is to just do colonoscopies on younger people. Other options are doing a shorter scope called a sigmoidoscopy to catch only the left-sided cancers, and maybe we would start that at age 40. Or there are some new tests out where you would take a stool sample and see if there's any DNA of polyps. But those are pretty new, and we don't know the ramifications of that yet. So there are some options that we're looking through that we need to study to see what's the most beneficial way for everybody to potentially, hopefully, find polyps or cancer.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.